My name is Teresa Hothouse, and I am doing my video presentation on tonsillectomy. Tonsillectomy is a 3,000-year-old procedure. It's where your tonsils are removed from the side of your mouth in a recess called the pharynx at the tonsillar fossa. The procedure is performed in response to repeated occurrence in acute tonsillitis, snoring, and sleep apnea. The pre-op and the post-op medications and instructions would be that they don't normally prescribe any medication for you unless you have an infection, but they recommend that you do not take any aspirin or non-aspirin products for 2 weeks before and after the surgery. They also suggest that you admit the patient 1 hour prior to surgery. You can resume activities after about 7 to 8 days of the surgery, but during your recovery time, there should be no smoking, no lifting, no bending, and a lot of rest. As far as a diet would go for this, you would start off with soft foods such as clear liquids for the first 3 to 4 days. Then you can incorporate your soft foods such as eggs, mashed potatoes, bananas, applesauce. But make sure you avoid anything with a sharp edge, like a potato chip or corn flakes, anything like that. About 4 to 5 days after your surgery, you can start to incorporate soft solid foods like chicken, hamburgers, hot dogs. Some of the side effects that could occur during the recovery time would be your ears would hurt, a sore throat would be an obvious, because they're down in your throat here, because your tonsils are located right here. There'll be some swelling, might get a slight fever. Some bleeding may occur with this, so you should suck on some ice chips. Bad breath is a big thing with this, but that usually disappears within 8 to 10 days after your surgery. The medication that they would prescribe for you after your surgery, sometimes if you want to take it, it's acetaminophen with codeine for pain, or acetaminophen with hydrocodone. You can also take Tylenol, Advil. The adverse effects on these would include nausea, dizziness, mood swings. Your vision may get slightly blurred. If any of these occur and persist, do not hesitate to call your doctor or go to the emergency room. You should not drink alcohol with these medications. You should not take any other antihistamine with these unless it's approved and prescribed by your physician. This procedure is performed over 500,000 times a year. There are many instruments that are used for this procedure, but your main instruments would be your forceps, your scalpels, and scissors. If you experience a fever more than 102 degrees, immediately go to the emergency room or call your doctor. If there is any bright red blood that you're coughing up or coming out of your nose, whatever it may be, again, immediately go to the emergency room. If anything seems to be bothering you, you really should just go ahead, call your physician, ask questions. There's no harm in it. Usually about 2 weeks after the surgery, you're pretty healed. You can resume back to your normal working day or school day, whether it be an adult or a child. But again, tonsillectomy it's not performed as much as it used to back in the 1950s. They don't jump to conclusions to take your tonsils out at this point anymore unless you really have any of those side effects like I was saying. If you have recurring acute tonsillitis, snoring, sleep apnea, these are just a few of the things that will inform to a doctor to want to take a look and possibly take out your tonsils. If there are any questions, please feel free to email me. My email is on the website. Thank you.